is Dr. Corey Maas on Looking Your Best. I wanted to talk a little bit about cellulite today because historically there's been really no cure for cellulite. There have been a number of machines like endermology, which was a big roller machine that went up and down the leg, and if you did it enough, you probably got enough swelling to make the cellulite look a little better. There's all kinds of magic potions and creams which do virtually nothing. And so we've been really looking for an answer for cellulite for decades. It occurs in almost 90% of women to a significant extent, and if you look at all women overall after the age of 30, it's in most women. It happens in about 50% of men to some degree or another, so it's really a prolific disorder, and it really is caused by the fat herniating or protruding between little layers of fibrous tissue that touch the surface or grab onto the surface of skin, which gives that lumpy, bumpy appearance. It's really little fat bulging in between little fibrous septae pulling the skin down. And in large areas, it can look like lines, it can look like dimples, it can look like cottage cheese, as people often describe it. And so for many people who are even very shapely and do a good job with diet and exercise, it is a real problem. As I said, up till recently, those historic devices have offered little relief or improvement, but now there's a device called Cellfina, and Cellfina has really taken a technology that we've known about for many years and standardized it in a way that we can reproducibly improve cellulite. The procedure that we've done for years is called subcision, and it's really a process whereby a very tiny needle or blade is inserted underneath the skin and parallel to it, after numbing of course, and that blade divides those little fibrous septae completely and allows the fat then to be level with the skin, elevating dimples and some of the linear disfigurations or the indentations that we see in cellulite, and actually through the fibrosis or healing process allows a great deal of smoothing in the skin.
Okay, so there really are just a handful of components to the Cellfina device. This one has a shape on it, which is a rectangle, which corresponds to the rectangle that will be undermining that's visible in this disc right here. Or if we're going to do a teardrop, this is a direction that we're going to be undermining in a uniform fashion. The only other, and I'll have another one that has the teardrop on it, you'll see that. And that teardrop is a teardrop shape that you can see right here. That gives us the indication of which template we're going to use. And the last template, which has some betadine on it, and this is all the sterile field obviously, but this is just for local anesthesia, and the device works simply. I just click it in, and with the suction that you can see coming off here and attaching it, I've marked a dimpled scar on her bottom here, and then I can really look at this, and if we'll come in and zoom over the surface here, you'll see how this sort of suctions in, and I can look at it and see, well, is that triangle or rectangle going to cover it, or do I need to do a teardrop? And it's labeled 1, 2, 3, 4 with little lines. So I can see for me that this is probably going to do better with what I call a teardrop or T4, better than a rectangle, because I won't cover quite all of it. And I'm just going to let the suction do its magic here. When I get it in place, the skin up in place, and now I can see the teardrop covers the area of the depressed scar. And I'm going to use my local, and this is just a little, this local anesthesia device has little side ports in it, and I'm going to slip that into my template, which is quite simple to do. Do the local first. So you will feel a little pinch. Are you ready? Okay. 1, 2, 3, little pinch, and then we'll just go slow with the local and let that, that's about 1 cc we'll use there. Once I've done that once, I'll come back and it'll stop. But I'm going to demo this for a second. You can see I'm going to hold this so you can see go ahead and give a squirt there for me, Arnold. I don't know if that's visible, but you can see it comes out through all the side ports here. I'll give you a better background. You see the side ports working. So I'm going to actually do the same thing again, and then I'll break the suction that you can see right here, and that's really just putting my finger up underneath the disc here and releasing the suction. And what's interesting about this, it kind of gives the patient a little bit of a hickey, if you will, but you can see my teardrop shape imprinted into the skin, so I know I'm covering this with a depressed scar, which you can't see it as depressed right now. So I'm going to do a teardrop, or T, and it's going to be, you can see the line T1, T3 covers it slightly, but really T4 gives me a little wider area, so there's remodeling. And this is a pretty deeply depressed scar, so once I've undermined that, that dimple will elevate and it'll really look nice. So I'm just going to drop it really right on the same place that I had it before. And I can see once the section starts that I've got it covered. And then my little, you can see this is what the sort of magic wand is, if you will, a little reciprocating blade here. That now she's numb, she won't feel that at all. And I put it through a little diaphragm. And then I turn it on. It's kind of noisy, but I'm just going to follow the pattern that I'll describe here until I turn that off, because there's a little diaphragm in here that has to stay intact, and that would disturb that. Now the treatment's done. I'm just going to release this, and you can see there's very little bleeding. She's got a little blanch here. That's mostly local anesthesia you see coming out. We'll squirt that out a little bit so the local comes away, and that looks kind of funny, but you can see how tiny the little incision is. Almost nothing, and really virtually no bleeding there. So that's really a good thing for the patient, because we've undermined that full scar and that elevates it. And that's really the whole Cellfina treatment. It's very simple, very effective. We'll put a little pad over that. She'll wear some Spanx for a couple days really. Some people wear it for as much as a week, as much as possible, so that helps to flatten everything. And though several other areas will do, but I've designed it so that they're not overlapping these little treatment sections.
The Cellfina device, which we have employed and have had now some excellent experience with, provides a substantial improvement. We'll pick certain areas that are the worst to treat first. We can't really overlap areas that are very heavily confluent, where there's areas of overlap with cellulite, but over a period of treatments, depending on how extensive it is, we can get most of the skin smooth. We also have some newer approved drugs, such as Kybella, which is the fat dissolving drug that we can use as an adjunct. That would be a completely off-label use of the drug, but we do know that it causes lysis or breakage of fat cells. So in certain people, along with Cellfina and some of the other treatments, we can break up or really cause the herniated fat to flatten also. The last of this combination of therapies, which I think is really the way to address cellulite, is a treatment called VelaShape, which by itself we haven't found to be a phenomenal treatment, although some improvement is achieved. VelaShape is using radio frequency or a gentle heating process over the skin, along with the roller device and infrared light, and with that there's some skin tightening. So with the combination of Cellfina subcision, Kybella in those cases where it's resistant fat that we can't completely get, and then VelaShape, we can consistently provide real improvements for cellulite patients, and that's really virtually everyone. So if you've thought about it and you're not looking as good as you did in your bikini 5 or 10 years ago, or you'll wear that short dress, or you'd like to wear that short dress again, I think that this combination of therapies is the way that really should be approached, and we can get you back into those using a combination of Cellfina, Kybella, and VelaShape very effectively. If you have any other questions about cellulite, about the treatment with VelaShape, treatment with Kybella and off-label uses of that drug, the new drug that was actually designed for neck fat, but has certainly other applications, or the new Cellfina device, please don't hesitate to write or call us. As always, it's my pleasure. This is Dr. Corey Maas on Looking Your Best.